If you're still working when you turn 65, one wrong Medicare decision can cost you thousands of dollars, and in some cases, permanently limit your coverage options. Most people assume they should just sign up for Medicare at 65. But if you have employer insurance, starting Medicare at the wrong time can accidentally trigger deadlines you can never get back. In this episode, we'll explain exactly how Medicare works when you're still working, when it makes sense to delay Part B, and the critical rules that can protect you from lifelong penalties. If you plan to work past 65, this is something you need to understand before you make a decision. Welcome to the Medicare podcast by Seminars. This is Matthew Clausen's avatar. All episodes of our Medicare podcasts are researched and written by Matthew Clausen. In this show, we explain Medicare in easy-to-understand terms, helping you understand your options and avoid common mistakes. Today's episode, episode 14, is titled Working Past 65, When Employer Insurance and Medicare Overlap. If you are still working at 65, one of the most important Medicare decisions you will make is whether to enroll right away or delay coverage. Handled correctly, delaying Medicare can be perfectly fine. Handled incorrectly, it can create permanent penalties or permanently limit your future options. Let's walk through this carefully. When you turn 65, you become eligible for Medicare. But you are not required to enroll in Part B if you are covered under a group health plan based on current active employment. That can be your employment or your spouse's employment. The key phrase is current active employment. Retiree coverage does not count. COBRA does not count. Those types of coverage do not protect you from Part B penalties. If you are covered under a group health plan from an employer with at least 20 employees, and that coverage is considered creditable for Part B purposes, you may delay Part B without penalty. Now, this is where the decision becomes strategic. The moment you start Medicare Part B, your Medicare Supplement open enrollment period begins. That period lasts 6 months or 180 days. During those 6 months, you can enroll in any Medicare Supplement plan available in your state without answering health questions. You cannot be declined. You cannot be charged more because of medical conditions. This is a one-time guaranteed issue window. That clock starts the month your Part B becomes active. Not when you retire, not when employer coverage ends, not when you feel ready. It starts when Part B starts. After those 6 months pass, in most states, changing Medicare supplement plans later requires medical underwriting. That means answering health questions. It means you can be declined. It means certain conditions can prevent switching. So if you start Part B at 65 while still working, simply because you assume you might as well, you may unintentionally use up your guaranteed supplement window while still on employer coverage. Then, years later, when you retire, you may not have guaranteed access to the supplement plan you prefer. This is why you should never start Part B until you are ready for Medicare to be your primary insurance. Once Part B begins, Medicare may become primary, your employer plan may become secondary, and your 6-month supplement clock begins. This is not just a premium decision, it is a long-term structural decision. Now let's define creditable coverage. For Part B, creditable coverage means you are covered under a group health plan tied to active employment, and that employer has at least 20 employees, so the employer plan remains primary. But here is something many people overlook. A business can have creditable coverage for Part B and not have creditable coverage for Part D. Those are separate standards. Part D refers to prescription drug coverage. For Part D, creditable coverage means the employer's drug plan is expected to pay, on average, at least as much as standard Medicare drug coverage. Employers are required each year to notify employees whether their prescription coverage is creditable. Keep that notice. Save it. You may need it to avoid a Part D penalty. Now let's talk about penalties. If you delay Part B without proper creditable coverage, Medicare adds a penalty of 10% of the Part B premium for every full 12-month period you were eligible but not enrolled. That penalty lasts for life. For Part D, if you go more than 63 consecutive days without creditable drug coverage after becoming eligible, Medicare adds 1% of the national base beneficiary premium for every month you were uncovered. That penalty also lasts for life. This is why you do not guess, you verify. You do not assume employer coverage protects you, you confirm that it does. Now let's discuss Part A. You do not have to start Part A and Part B at the same time. If you qualify for premium-free Part A, you may enroll in Part A and delay Part B. However, if you contribute to a health savings account, enrolling in Part A makes you ineligible to continue contributing to that account. That must be coordinated carefully. Another major factor in this decision is spousal coverage. If your spouse is covered under your employer plan, it may seem cheaper to stay on that employer plan. But many people assume employer coverage is better insurance or lower cost without actually comparing it. That assumption is often wrong. Medicare, especially when paired with a Medicare supplement, is frequently more comprehensive and sometimes less expensive overall. This is not just about premiums, it is about deductibles, coinsurance, out-of-pocket maximums, spousal premiums, and long-term predictability. At MedigapSeminars.org, we provide a free calculator to help compare employer coverage and Medicare so you can see the numbers clearly. Sometimes staying on employer insurance makes sense. Sometimes enrolling in Medicare at 65 is clearly better. The only way to know is to run the analysis. Now let's talk about documentation. When you are ready to enroll in Part B after delaying, you must submit the Part B application and a form completed by your employer verifying that you had group health coverage through active employment. That employer verification protects you from the Part B penalty. For Part D, your proof is the annual creditable coverage notice. Keep your records. Finally, understand the timing rules when you retire. When your employment ends or your employer coverage ends, you receive an 8-month special enrollment period to enroll in Part B without penalty. For Part D, you have 63 days. COBRA does not extend your Part B special enrollment period. Retiree coverage does not extend it. If you miss those deadlines, you may have to wait for the general enrollment period and may face penalties. Let me summarize. If you are working past 65, you may delay Part B if you have proper employer coverage. You can start Part A separately if appropriate. Never start Part B until you are ready for Medicare to be primary because doing so triggers your 6-month Medicare supplement open enrollment period. Make sure your prescription coverage is creditable. Understand the penalties before delaying. Do not assume employer insurance is better, and always compare the numbers. If you're turning 65 soon, already on Medicare, or just want to make sure your coverage protects you properly long-term, you can visit MedigapSeminars.org. Our guidance is always free, and we help people choose correctly the first time. You can also call us at 800-847-9680. Again, that number is 800-847-9680, or visit MedigapSeminars.org. On the website, you will find educational articles, videos, and even an AI chat box to answer your questions. This has been Medicare Podcasts by Matthew Clausen at Medigap Seminars. If this episode helped you, share it with someone who's about to enroll. These small details really do make a big difference.